back to the deep dive. Today we're plunging into a topic that, well, it pretty much touches every single one of us. The incredibly dynamic, always changing world of nursing and healthcare. It's a field going through massive shifts, and our mission today is really to cut through the noise, figure out the most important changes, the big challenges, and maybe the exciting opportunities shaping this vital profession.
Absolutely. And we've got some fascinating sources to work with today.
Yeah.
Yeah, everything from these big national reports laying out long-term plans to practical insights on tech and even the well-being of the nurses themselves. It paints a really comprehensive picture, I think.
Right, an interconnected view.
Ex-
Okay, so whether you're working in healthcare, maybe navigating the system as a patient, or honestly just curious about what keeps us all healthy, the insights we're about to dig into should give you a real shortcut to understanding the huge role nurses play and what the future of care might look like. All right, let's unpack this. We really have to start with the foundational stuff, right? The work that's kind of mapped out the future for nursing. I'm thinking back to the Institute of Medicine, which we now know as the National Academy of Medicine, or NAM. That first Future of Nursing report in 2011, that was huge.
It really was groundbreaking. That first report, it laid out some incredibly ambitious goals for the decade, 2010 to 2020.
Like what?
Well, for starters, they wanted 80% of nurses at least to hold bachelor's degrees, BSNs, by 2020.
80%.
Yeah, and they aimed for a 100% increase, a doubling of nurses with doctoral degrees in that same time.
Right.
And a really crucial piece was about advanced practice registered nurses, APRNs. They wanted them to practice to their full scope, without unnecessary restrictions in every single state.
Which is still a conversation today, isn't it?
Oh, absolutely. Beyond that, the report pushed for nurses in leadership roles, making decisions, collaborating better with other professions, and finally, better data collection and getting more diverse individuals into those leadership spots.
Okay, but here's where it gets really interesting for me. In 2016, NEM actually went back and looked at how things were going with that first report. And while, yeah, progress was made, they didn't quite hit all those big goals.
Right, not fully. The evaluation pointed out the need for, bigger policy changes, new laws, more funding, always funding, and importantly, tackling those societal things, lower incomes, lack of educational opportunities in some areas. Those are real barriers.
Shows just how complex changing a whole system is.
Definitely. And that evaluation leads us right into the next phase. NAM didn't just stop. In 2021, they put out their third report, charting a path to achieve health equity.
Okay, so a shift in focus.
A very pointed shift. This one sets goals for 2020 to 2030, really zeroing in on eliminating systemic racism and achieving health equity here in the U.S. It builds on the first report, but puts a huge emphasis on the social determinants of health, things like housing, education, access to food, and strengthening nursing itself as the key to getting there.
So bringing it back to the listener, why does all this policy stuff, these big reports, actually matter to you?
Well, because these aren't just documents sitting on a shelf. They're essentially the blueprints. They shape how nurses are educated, how they deliver care, what policies get pushed for nationally, and all of that eventually trickles down and affects the healthcare you receive. It sets the stage for your future experiences.
Right, so those are the big picture plans.
Yeah.
But it makes you think, who's looking out for the nurses themselves? You can have the best plans in the world, but if the caregivers aren't doing okay.
That's a critical point, and it's exactly what the American Nurses Association, the ANA, tackled back in 2017 with their Healthy Nurse, Healthy Nation initiative. HNHN, they call it.
Healthy nurse, healthy nation. Okay.
Yeah, the whole idea was to promote healthier lifestyles for nurses, aiming to boost the health of the, nearly 4 million nurses we have in the U.S. They focused on 5 key areas.
Which were?
Getting nurses more physically active, improving their overall quality of life, making sure they get enough rest, which is huge in nursing, improving nutrition, and boosting safety both at work and in their personal lives. It's pretty holistic.
It's kind of surprising, maybe even a bit shocking when you hear the stats, though, isn't it?
Yeah.
Research shows nurses are often actually less healthy than the average American.
That's true.
More likely to be overweight, higher stress levels.
Yeah.
Kind of goes against that image we have.
It does. And the ripple effect is really profound. It's not just about the nurse feeling better individually. A healthy nurse, and the ANA talks about this holistically, right? Physical, environmental, social, mental, professional well-being. That nurse becomes a role model. They're more resilient, more present, maybe more empathetic, and that can directly impact how well patients follow advice, the trust they have. It's this cycle where the caregiver's well-being really connects to the community's health.
So it really poses that question. If the people looking after us aren't well, what's that mean for the care we get?
Exactly. Supporting nurse health isn't just, a nice thing to do. It feels like a critical investment in public health for everybody.
Okay, so building on that idea of support,
Yeah.
let's shift focus a bit to another really crucial concept: collaboration in healthcare. Teamwork, basically.
Yes, but maybe taking it a step further than just, being nice to each other. Collaborative healthcare really means health professionals actively communicating, creating plans together, and working towards the same goals for the client.
It starts with communication.
Excellent communication,
Yeah.
absolutely. And really importantly, mutual respect. Recognizing that every single discipline, doctors, nurses, therapists, social workers, pharmacists, brings something vital to the table.
So how does that play out? Are there different kinds?
Yeah, you can think about it in a couple of ways. First, there's interprofessional collaboration that's within the immediate healthcare team.
Okay.
It's about understanding each other's strengths, skills, maybe through joint seminars or just working closely on cases. Think about someone recovering from a stroke. The nurse might see a mood change. The physical therapist notices a new difficulty with movement. The speech therapist picks up on swallowing issues.
Right.
Real collaboration means they're sharing that instantly, adjusting the plan together. It's crucial for good outcomes.
Okay. So that's the team working together day to day. But what about those trickier situations, like when a patient moves between, say, a hospital and a nursing home, or needs help from different places in the community? That seems like a place where things could fall through the cracks.
You're spot on. That's where interorganizational collaboration becomes absolutely vital. It's especially critical for safety during those transfers. Hospital to long-term care is a classic example. Information gets lost, meds get mixed up. It happens. Smooth collaboration between the organizations is needed to prevent that. It's also key when you're coordinating with different community resources, maybe mental health services, transportation help, Meals on Wheels. You need the different organizations talking to each other effectively.
And the payoff for all this teamwork.
Well, ideally, it reduces costs because you're not duplicating tests or services unnecessarily, and it just leads to more efficient, more streamlined care for the patient.
Feels like a win-win.
It really should be. And for you, the listener, think about it. This isn't just jargon. It's about your safety. It's about ensuring you get seamless, high-quality care, especially if you're moving between settings or dealing with multiple health issues. Good collaboration means safer, better care for you.
All right, now we absolutely have to talk about technology. It's transforming pretty much everything, and healthcare is right in the thick of it. Let's start with telehealth, something we all got very familiar with recently.
We certainly did. Telehealth isn't brand new, of course, but the pandemic just massively accelerated its adoption. It became a primary way to deliver care almost overnight in some cases.
And nurses are key here.
Absolutely vital. They're involved in everything from actually developing and implementing telehealth programs to providing direct care through video calls or remote monitoring.
Like what kind of direct care?
Oh, tons of things. Patient education, helping manage chronic conditions like diabetes or heart failure from afar, discharge planning and follow-up after a hospital stay, even remotely checking vital signs or lab results through connected devices.
Wow.
Yeah. And they also act as patient navigators, case managers, consultants, all using telehealth platforms. It extends their reach significantly.
And it looks like it's here to stay. I saw a projection that telehealth could be, more than half of all healthcare services by 2030?
That's the projection, which means we absolutely have to build telehealth training into nursing education for current nurses and students. It's becoming a core competency.
Okay, so telehealth is one huge piece. What about social media? That's everywhere too. Good or bad for healthcare?
Well, like most tech, it's definitely a double-edged sword. On the plus side, people can get firsthand info on health issues, find support groups, maybe use apps for health improvement. Teams can communicate faster sometimes.
The downsides.
The downsides are significant. Misinformation spreads like wildfire. That's a huge one. And then there are major concerns about client privacy and confidentiality.
Right, IPA and all that.
Exactly. The ANA's Code of Ethics is crystal clear. Nurses have a duty to protect client information, period. That includes online. And beyond privacy, it's about maintaining professional boundaries. Avoiding those negative comments about colleagues or your workplace online. It seems obvious, but it happens.
And then there's the device we all carry, the cell phone. In a hospital or clinic, how do you balance the good, quick access to info with the bad, like distraction?
It's a constant balancing act. The benefits are real. instant access to drug databases, clinical calculators, treatment guidelines. It puts evidence-based information right in their pocket. Great for quick checks, even patient education using videos.
Yeah.
But the potential for distraction is immense. Looking something up can easily turn into checking a text message, and that split second can matter hugely in patient care, increasing the risk of errors. Plus, photography raises privacy flags you need clear policies and consent. Generally, personal use needs to be kept to breaks, away from patient care areas. It comes down to professionalism and focus.
So faster info, more flexible care options for us as patients, but also we need nurses to be super vigilant about privacy and not getting distracted.
That's the trade-off we're navigating.
Okay, so imagine trying to integrate all this new tech into a system that's already feeling stretched.
Yeah.
This leads us to maybe the most urgent issue right now, the nursing shortage. We hear about it all the time. It's real, and it's projected to last until at least 2030.
It is very real, and it's not just one single cause, which makes it so tricky. It's like a perfect storm of factors hitting all at once.
Such as?
Okay, first, you've got a huge wave of experienced nurses, the baby boomers, retiring over the next 10, 15 years. That's a massive loss of expertise.
Okay, retirements. What else?
Then our population is dealing with more chronic illnesses, diabetes, heart disease, you name it. That requires more ongoing, complex nursing care.
Makes sense.
At the same time, there's a shortage of nursing faculty, the people who teach new nurses. So schools actually have to turn away qualified applicants because they don't have enough instructors.
But we can't even train enough replacements quickly.
Exactly. It creates a bottleneck. Add to that, the population over 65 has shot up something like 73% since 2011. Older adults generally need more healthcare services.
Right.
And finally, there's high turnover, nurses leaving the bedside due to burnout, stress, sometimes even workplace violence. And COVID-19 just threw gasoline on that fire. Many nurses reached their breaking point.
The ANA is calling it a nurse staffing crisis. When you hear that word crisis, what does that practically mean? Is it really that bad?
I think crisis is accurate because it directly impacts patient safety. When units are short-staffed, nurses are stretched incredibly thin, patient-to-nurse ratios go up, stress levels skyrocket, and tragically, the risk of mistakes, of medical errors increases. That's why it's a crisis.
So what's being done? What are the proposed solutions?
Well, there are several strategies being pushed. One big one is adjusting staffing based on how sick the patients actually are. Acuity-based staffing, not just counting heads.
Okay, more tailored staffing.
Right. Protecting nurses' safety and well-being is huge. Addressing burnout, preventing violence, providing better psychosocial support. Prioritizing fair wages and decent working conditions seems obvious, but it's critical. And going back to the bottleneck, actively encouraging experienced nurses to become educators to help grow the pipeline.
The goal being?
Fewer errors, happier patients, and nurses who actually feel supported and want to stay in the profession.
Yeah. And this really isn't just some abstract problem for hospitals. For you, listening, this directly impacts the care you or your family might receive. Understanding it helps us all push for solutions.
It really does. It affects everyone.
Okay, let's broaden that a bit now and talk about health promotion. This is where nurses really empower people to take control of their own health, right? Preventative care.
Exactly. The World Health Organization defines health promotion as basically empowering people to increase control over and improve their physical and mental health. It's not just about individual choices, though. It really emphasizes creating environments where healthy choices are the easy choices and tackling those bigger issues like social injustice, poverty, lack of resources that create health imbalances.
So it's societal, too.
Very much so. WHO laid out 5 key strategies way back in '86 that are still relevant. Things like creating healthy public policies, educating people to develop personal skills, fostering supportive environments, strengthening community action, and reorienting health services towards prevention and holistic care.
And nurses are often on the front lines of that, helping people make lifestyle changes for things like obesity, diabetes, heart issues, things that are often preventable.
Absolutely. They're key educators and motivators. This ties into national efforts, too, like Healthy People 2030 here in the U.S.
Right, I've heard of that.
Yeah, it's run by the Office of Disease Prevention and Health Promotion. They set national health goals every decade, things like cutting smoking rates, improving nutrition, managing stress, boosting vaccination rates.
How are we doing with those goals?
It's mixed. We've made progress in some areas, but there are persistent challenges, like improving overall life expectancy, reducing infant mortality, tackling the obesity epidemic, especially in communities that face health disparities. It's a constant effort.
Okay, and connecting this back to the patient experience, we need to touch on health literacy. What does that actually mean for you when you're trying to understand what your doctor or nurse is telling you?
Health literacy is basically your ability to find, understand, and use health information to make good decisions about your health. It sounds simple, but think about how complex medical language can be.
Oh, yeah. Confusing.
Totally. So the nurse's role is critical here. It involves really listening to your concerns, accepting them without judgment, and then providing information that's clear, accurate, and easy to understand. Giving you reliable resources, too, which is so important now with Dr. Google and social media being everyone's first stop.
Right, filtering the noise.
Exactly. And there's a growing trend to really embed health literacy training into nursing school, so nurses are even better equipped to be clear communicators and patient advocates.
So these things, health promotion, health literacy, they're really the tools that empower you to be an active participant in your own health. And nurses are kind of the guides helping you use those tools.
That's a great way to put it. They're navigators.
Now, we need to address a couple of really tough but critical issues. They impact nurses directly, but also have huge public health implications. First, let's talk about impaired nursing. It's a sensitive topic.
It is sensitive, but very important. Substance use disorder, or SUD, affects nurses at rates pretty similar to the general population. It's not that they're more prone, necessarily, but the consequences can be devastating.
What are the main concerns?
Well, the most obvious and serious is the risk of harm to patients or to the nurse themselves. Then there's the emotional toll on colleagues who might suspect something or have to report it, the disruption to the unit. It's incredibly stressful.
Are there specific risks nurses face?
Yes. They often have easier access to powerful, addictive drugs, opioids like fentanyl, hydromorphone. They also have the medical knowledge to potentially self-medicate, sometimes thinking they can manage it. And the job itself, the emotional and physical exhaustion, can lead some to unhealthy coping mechanisms, including substance use.
What does the profession say? The ANA Code of Ethics.
Interestingly, the code emphasizes a dual responsibility. Nurses have a primary duty to protect patients from harm, but they also have a responsibility to advocate for colleagues who are impaired to get help and treatment. It's about support and recovery, not just punishment.
How might someone recognize if a colleague is struggling? What are the signs?
Some general signs might be changes in appearance, looking disheveled mood swings, isolating themselves. Someone misusing alcohol might chew a lot of gum or use mints excessively. For opioid diversion, it can be trickier. Sometimes the nurse rarely calls out sick because they need access. They might frequently offer to administer pain meds for other nurses' patients, or you might notice their patients consistently report needing more pain relief during their shift, potentially because meds are being diverted.
And if someone is suspected?
Typically, a fitness for duty assessment is done, often involving drug testing. If SUD is confirmed, treatment is usually mandated as a condition of keeping their license. There are resources, like from the National Council of State Boards of Nursing, NCSBN, to help facilities manage this and support nurses in recovery.
That issue of access and addiction flows right into the larger crisis. The opioid epidemic, it's impacted communities everywhere.
Tragically, yes. And the history is complex. Opioids have been used for pain for centuries, but their widespread use, sometimes for minor issues, happened partly because of weak regulation early on. Then, fast forward to the late 90s, early 2000s, there was this big push to treat pain more aggressively.
The fifth vital sign idea.
Exactly. The Joint Commission, designating pain as the fifth vital sign around 2001, while well-intentioned, is now seen as having inadvertently fueled the crisis. It led to much more prescribing of opioids, even for routine procedures, which dramatically increased the amount of these drugs in people's homes, leading to misuse, addiction, and diversion.
And the numbers are just staggering. Since 2000, overdose rates climbed alarmingly. In 2018, something like 70% of overdose deaths involved opioids.
It's devastating. And the pandemic made it worse. Drug deaths surged post-COVID, likely due to increased stress, isolation, and sadly, an increasingly toxic illicit drug supply, often contaminated with fentanyl.
What's the strategy now to fight this?
The U.S. Department of Health and Human Services has a 5-point strategy. It includes increasing access to treatment and recovery services, promoting the use of overdose-reversing drugs like naloxone Narcan, which is thankfully becoming available over the counter now.
That's huge.
It is. Also, better public health surveillance and education, supporting research into pain and addiction, and crucially, promoting better, safer pain management practices so we rely less on opioids up front.
These are such tough, interconnected problems. Understanding the risks within nursing and the broader opioid crisis helps us all, hopefully, recognize signs and support efforts toward solutions.
Absolutely. Awareness is key.
Okay, let's bring it back to the core of being a professional nurse. We need to talk about lifelong learning. It feels fundamental, especially in a field that changes so
Oh,
fast.
it's absolutely non-negotiable in healthcare. Medicine, technology, research is all advancing constantly. Nurses have to stay current to provide safe and effective care. It's a professional obligation.
How do they do that practically?
Well, most states require continuing education units or CEUs to maintain licensure. The specifics are set by each state's Nurse Practice Act. Nurses get these credits through online courses, hands-on skill refreshers, workplace training, attending workshops, or conferences. Lots of ways.
And I've heard the term evidence-based practice used a lot. Is that part of lifelong learning?
Yes, it's a core component and a specific method for lifelong learning. It means nurses aren't just relying on how we've always done it or personal anecdotes. They're trained, often guided by recommendations from groups like the National League for Nursing, NLN, to seek out, evaluate, and apply the best available evidence from research, scientific studies, and established best practices when making decisions about patient care.
So it's about using proven methods.
Exactly. It ensures the care they provide is based on solid evidence, not just tradition or habit. It directly links learning to improved patient outcomes and safety.
So this commitment to lifelong learning, it's really a promise a nurse makes to their patients, to themselves, and to the profession to stay competent, ensure safety, and keep improving.
Beautifully put. And for you, the listener, what this means is that the nurse taking care of you is dedicated to using the most current, effective, and safest approaches available. They're always learning, always striving to do better. It's a huge part of the professional commitment.
Wow, okay. What a journey we've taken today. We've really covered a lot of ground in this deep dive, haven't we? From those big policy blueprints by NAM, the focus on keeping nurses healthy with H&H-N, the complexities of collaboration.
And the impact of technology, both good and bad. Telehealth, social media.
Right. And that huge challenge of the nursing shortage, plus the importance of health promotion and health literacy, and those tough issues like impaired nursing and the opioid crisis.
It really shows how nurses sit at the crossroads of so many critical issues. Connecting all these dots, you see the massive impact they have on us as individuals and on the health of our whole community. It's incredibly complex, but their role is just so central.
So what does this all mean for you listening right now? As you think about your own health or watch the healthcare system evolve, we really hope this deep dive leaves you feeling more informed, not just about the amazing people doing this work, but about all the forces shaping the care that you and your family rely on. And maybe a final thought to leave you with, as we look ahead, with these big goals for health equity, the reality of the nursing shortage, and this explosion in telehealth, how do you think that balance will shift? The balance between high-tech tools and that fundamental human connection nurses provide. What does care even look like in the next decade? Just something to ponder. What part of nursing's future stands out most to you?
That's a great question to think about.
Thank you so much for joining us on this deep dive.